So it's I'm delighted to start or kick off panel 4, and Professor Julian Savulescu will be chairing this last panel, and we've got Dr. Kalyani Mehta joining us on Zoom, along with Professor Angelique Chan, Dr. Noreen Shan, Dr. Kenny Tan, and Ms. Yong Leong Ying. So if I could just introduce you to some of those, because obviously we've been introduced earlier to Angie and Julian. I'll do some brief introductions for the other members of this panel. So, and here we are about, getting the trick of getting your glasses out to do the reading. Leong Ying has been with the Child Foundation since 2012, and she's been working in the counseling and coaching department and was seconded to lead the Community Care Management Service in 2018. In 2020, she was also the lead for the Dementia Care System Services and provides clinical supervision to care managers and psychosocial input to the teams during care planning sessions. She was previously a principal medical social worker in a restructured hospital before joining the Tsao Foundation. Dr. Kalyani Mehta, who's joining us on Zoom, so she's up there on the screen. She is the former head of the Master of Gerontology degree program at the Singapore University of Social Sciences and launched the first PhD in gerontology in Singapore back in 2017. Dr. Mehta is an outstanding researcher on aging issues, and she's published many books and over 50 articles in social work and gerontology journals, and she's been a consultant to international and regional organizations and is well recognized internationally for her academic publications. Not to forget also a stint as being a nominated member of Parliament from 2007 to 2009. In a volunteer capacity, she advocates for caregivers through her involvement in the Silver Caregivers Cooperative Limited. We also have Dr. Kenny Tan here with us. He was appointed the CEO of St. Luke's Elder Care back in 2016. He is established in both clinical and healthcare management, with a previous operating role as the Chief Operating Officer in St. Luke's, and has brought the community hospital and elder care centers through capacity growth and infrastructure in their services. For his work, he's been awarded the Healthcare Humanity Awards back in 2016, and most recently the Public Service Medal for his contribution to Singapore's fight against COVID-19. So, I don't think I've left anybody out. So, I would just like Professor Savulescu to now start the panel. Thank you very much.
Okay, thanks very much, Sumi. Can we have the case up on the screen? So we're going to start with the case. There's plenty of opportunity for audience participation. So we will start with a couple of questions to the panellists, then move to the audience. So you'll be involved. So the case one is Mr Sal is an 83-year-old widower who has lived alone in a HDB flat since his wife's death 7 years ago. His son, who is often away on business, enrolled him in a community befriender program. Mr San Gupta, a retiree and volunteer befriender, has been visiting Mr Tsao and reports his concerns about the older man's lack of interest in conversational socialising to Ms Tsao, a volunteer program director at a community organisation. And this is Mr San Gupta. I've been visiting Mr Sal for 2 months now. He's always polite, but it's hard to have a conversation with him. I don't think he can hear well. My father is the same way, always saying, "What?" He takes no interest in anything. He doesn't want to go downstairs to the activity centre. He doesn't want to sit with the other uncles in the void deck or the coffee shop. He doesn't even have the TV or the radio on. He just sits in his flat. I keep thinking, what if he were my father? Mr Sal's son hardly looks in on him. What about suggesting those CCTV cameras for elderly people who live alone so you can keep an eye on him? Okay, so we have a series of questions around this case study. Are there questions up? So I might pose the first question to Professor Angelique Chan. Why does Mr San Gupta's why does Mr San Gupta think Mr Tsao has a problem? To what extent would you agree or disagree with San Gupta's point of view?
Thank you. I will try to answer that. First of all, I don't think he has a problem. I think Mr. Sal can't hear, which is probably why he doesn't have the TV or the radio on, or doesn't want to engage in conversation with Mr. San Gupta because he can't hear half the time what's being asked of him. There may be cultural differences at play in terms of Mr. San Gupta relating to Mr. Sal, but I'm not sure about that. No information on Mr. Sal's cognitive ability, so there may be some issues there. I think the fact that Mr. Sal doesn't have a good relationship with his son is probably underlying some of his reluctance to go out. He's probably reluctant to go out also because there's nothing that interests him outside. I was talking earlier about, personally not being interested in going to a senior activities center. And if there were other activities perhaps that were not group activities, I might be interested. One suggestion might be to have conversations with Mr. Sal about his past and to understand how he got to where he is right now. But I think fixing the hearing problem would be a good idea, and CCTV cameras would definitely not.
Very good. So we've got a tight schedule, and you've kept beautifully to time. Professor Noreen Chan, what's your perspective on that question?
Thank you. I would ask another question, which is, what is the problem and whose problem is it? Earlier on, in the previous session, someone asked a question about whether or not we're medicalizing loneliness or social isolation, and I think that's a really good point. I'd like to say that we do need to we need to distinguish between isolation or being alone and actually loneliness, because one can be surrounded by hundreds of people, as we do, for people in nursing homes or in other institutionalized settings, and you could be the loneliest person in the world. Now, at the risk of being bold, I would like to suggest that we think about loneliness as really the perceived lack of meaningful relationships. And those relationships include the relationship with ourselves. We don't talk about it enough, that sometimes when we get older and there are changes visited upon us, physical changes, cognitive changes, some people have difficulty relating to the new me. I'm losing my looks, I'm losing my abilities. How do I think about myself now? So it's not just about relating to the outside, it's about relating to inside as well. And therefore, I see this really as a process of adaptation and a journey rather than a problem. The worry I have about so-called medicalizing this is we see it as a problem. And of course, a problem must be fixed. And if I were to quote Rachel Naomi Remen, is that if you see life, as a problem that needs to be fixed, then actually you see life as broken. I don't think life is broken. I think that there are bumps along the way, and I think that we have to make this journey, and there are many twists and turns, but it is not a problem to be fixed. It is a life to be lived. It is an individual to be respected, someone to be understood, and then together to find a way forward.
Thank you very much. Do we have contributions from we're going to bring our other panellists in on some of the other questions. We've got time for audience questions. Maybe I can give you both a question then that arose in your talk, your excellent talk. So in philosophy, there is this idea of the paradox of hedonism, that if you directly aim at happiness, you don't get it. You achieve happiness indirectly through engaging in meaningful activities with other people, through charity, through work, through doing things. And it seemed to me that social relationships could be a little bit like that. It's nice to have somebody around, it's nice to say hello to somebody, it's nice to have someone caring for you, but when I think about my own life, the richest social relationships I have are secondary to doing things, to doing sports or to doing work or to playing games. And, I wonder in this case of Mr Sal, whether this is a case where we haven't found out what he likes doing, and rather than trying to have a conversation, I remember when my mother had dementia, it was difficult to have a conversation, but she liked to play games. And she was still quite good at games, actually. She still beat us at some of those games. So, how important do you think play, activities, doing things are as a way of socialisation or of maintaining a social network?
I recently read an article on the dimensions of achieving happiness. And social relationships did come out a winner, but engaging in activities was second. So I think it's extremely important because it does get you out there, it does get you engaged, if not with other people, with the world, And so I think that's it's an extremely important element to finding happiness.
Other audience, please. We've got roving mics. Yep.
Noreen, Angelique, just want to ask you a question on that study you mentioned. Did they segment it by gender? In other words, the importance of social relationships come in first and activities second?
No, they didn't.
Okay, because I have a suspicion that there is a gender bias, meaning what Julian said is probably true in my limited observations. The men in daycare centers tend not to have conversations or relationships, but they're okay doing things. So if I bring out a basketball hoop and some balls, they'll happily toss it in there, and over time they'll have a conversation with each other. And as one of my colleagues said, men are different from women in that they don't talk to each other, they talk with each other while doing something else.
Yeah.
So I don't know, that's why I asked the question. I just wondered whether that was a gender difference.
Yeah, there wasn't a gender difference in the study, but I totally agree with you because the one time that we did work with men and women in the SAC on a health-related project, the only time that men came down to the SAC was we had given blood pressure monitors out to the staff, and they came down to check their blood pressure to see how good it was with the other guys, So it became a competitive process, and they were down there every morning, yeah, and then some of them stay for coffee, right? So it's a different thing. Men, react differently.
Yes, if I could just respond, St. Luke's, we run 25 centers, so we've got males and females. We've got more females because they outlive the males, so they end up... I'd like to challenge the notion that men don't like to talk. There's nothing a good beer and peanuts, to kind of open up conversation. It's, I think, the conversational topics. If you bring up politics, you bring up things they used to do, they are able to converse. I think the problem is we don't allow the space, the time to have those conversations. Yeah, so it's just a response to you. A good beer and peanuts would sometimes help. But we don't serve beer just to clarify.
I've got other questions for the panellists, but any other audience questions? So Noreen, do you think there's a moral panic around loneliness?
I think there's a panic in some countries. The moment you appoint a minister, we know that the problem is very big.
No problem's not going to be solved.
They'll form a committee and then everything will grind to a halt. It's important to distinguish between isolation and loneliness. And isolation definitely has some health issues. During extremes of weather, when you couldn't get to isolated people, usually elderly, people died. So it's a real problem. But when you appoint a minister for loneliness, then that is something somewhat different. So I'm curious to see how this will evolve. I'm not holding my breath because, with everything else that's going on at the moment, with wars between countries and economic hardships, I'm not sure being a minister for loneliness is a good thing or a bad thing.
Do you and Angelique think that loneliness is becoming medicalised or excessively medicalised?
I think there is a possibility that it could be. And once we do that, then we forget to look at it holistically. And we think, as I said earlier, that it is a problem to be solved. But it isn't. I think it's an issue, but like I said, what is the problem and whose problem is it? And I see it as a challenge. I see it as a challenge to us as a society and as a community about how we collectively should see this. Because it doesn't belong, I think, to any one profession. It doesn't belong to the caring professions. It actually belongs to us. And the danger about medicalizing it and appointing resources and all that, then everybody else says, well, then it's not my problem. Because this guy, who's wearing the badge and the uniform, that's his job to do. It's not my job to do it. But it's our job. And I speak as a palliative care physician because looking after the sick, the vulnerable, the dying, is our job. It's not the doctor's job. It's not the hospice home care's job. It's us as a society. And if we forget that, then I think we are gone as a race.
Okay, we're nearly on to the second question. If the audience doesn't have a question, I've got another question for Angelique. Do you think it's being medicalised, and how do you think sociology specifically can help us understand the problem?
I don't think it's being medicalized because, as Giles was saying, most doctors will try and assess it as depression. So depression is obviously a medical issue, and it is a biological issue. But loneliness, we just don't have a firm enough handle on it right now. So we're in a space where we can prevent it from being medicalized, and I think sociology can help in the thinking through social activities, social engagement, the idea of a social convoy, maintaining relationships. Sociology can also help in terms of looking at the workplace, work-life balance, and sociology and social psychology and psychiatry can help in terms of the issues around identity and meaning in one's life. Because if you have that, then you're much less likely to be lonely.
Okay, thank you. Feel free to come in on the next questions. If we can move to the second question, please. So the second question is, what is the unique role of befrienders? It's the first time I've heard that term. But befrienders in providing care for an older person. Are there duties involved, and what are some common challenges? Could I start off with you, Leong Ying?
Yeah, probably let me share a bit about befriending service. Being a very ground person, and taking this case as a reference. Actually, this case is a very common case. I think most of us will face in the course of our work. Yeah. The thing that I want to add on is having befrienders. What is our goal that we want to achieve? Okay, is it empowerment, motivation, and the quality of presence? That is connectedness. The thing that I'm very concerned about is sometimes befriending service goes by hundreds of people that we serve, thousands of people that we want to serve in AAC. Then where is the quality of care? I struggle with that a lot in the course of my work. Yeah. So the role of a befriender to me is working with the person and not working for that person. Just like what you all have mentioned, looking beyond the diagnosis. Loneliness is a process. Is it a problem? To me, coping is the problem. We all have loneliness, but how come some can cope and some can't? So what is it that makes me curious about is the coping mechanism. Yeah. And I believe that we all connect on the sameness and grow on the difference. Yeah. So the role of a befriender, you see I got this whole chunk of notes that I prepared. So please be patient with me. Okay. Is to provide regular home visits. I think that is the nature of the befriending work. To provide context, be the eyes and ears for us, all right? Be part of that system. Monitoring the safety of the seniors. That is our utmost objective, isn't it? Yeah? Whether is there fall risk, is there safety issues, concern, the home environment, etc. And familiarity is important to seniors. Don't change every time with volunteers. Then how are we going to sustain the volunteers? To me, that is very, very important. I don't want to waste my time and resources train this particular person. And then after that, in 6 months down the road, I decided to quit. Yeah, I'll feel very sad lah. Okay? Then the other one is that we have to show commitment to care. For Mr. Sal, we have to show commitment to care. We have to show that we really care for you. Yeah? And there will be also the other one about the eyes and ears is also to alert the red flags. Is there suicidal ideation? Yeah? Is there a list of checklists that we probably have to develop for the volunteers to go in and probably eyeball a little bit, have some observation? Hey, please feedback to us. That is very important. Okay? Gathering the information, what habits, what routine, getting to know this person, and not a case lah. Can we look at this person as a person, and not a task that we need to visit? Yeah, I think there's a lot of mindset shift and the philosophy of care that we believe in. Yeah, of course, providing companionship, build relationship and trust. Now that comes to me. It takes two hands to clap. Friendship is important. How do we develop friendship? Friendship is not about once a month, I ting tong, hello uncle, I'm here. It doesn't work that way. Yeah. It is how to build that trust and how to build that rapport. It's a continuous process. Okay? And looking at Mr. Tsao, okay, he is a person, when I look at it, I struggle with this case because there is no other information that I have. Assessment. Yeah, I have a long list of questions that I want to find out so that I can work with the volunteer. For example, his vision, why is he not going down? Does he have poor vision? His hearing, is hearing impaired? I need a doctor to come in to help me to assess. Then I can get to know this person better and develop a good care plan. Yeah. So again, to train the volunteer to be an active listener, to have meaningful conversation, like Dr. Kenny has said. Time is needed. Are we able to afford half an hour to an hour just being with this person? All right? And sometimes, we do hear very common that the senior will tell me things like, oh, I'm so lonely, life is boring. Oh, it's like that one, nobody care about me. For Mr. Sal, it is like that, isn't it? The son is far, far away. And we have been seeing cases like that. The children are all over the world. And the older person is actually with one helper, or one helper caring for two older person. One can be wheelchair bound, one can be suffering from a person living with dementia. These are very challenging issues that we need to deal with on the ground. So with rapport and all building, probably one question that I want to pose to Mr. Sal is that if I can have a sense of some of his issues, his functions, then probably I can check in with him, if next week I'm going to come, this particular day, this particular time, so that I can build in the routine. What would you want me to do with you? Yeah, is it a coffee, have some activity, reminiscence? Yeah, what activity can we put in to facilitate conversation? I don't expect to sit down, hey, Mr. Sal, can you tell me your problem? It's not going to work that way. Yeah, what are the things that can help him to connect with himself in a safe manner? Okay, yeah. So where am I now? Yes.
So you said there's lots we don't know about Mr. Sal. I mean, what was striking to me is we don't know anything about him as a person. What was his history? What was his job? What did he care about? What did he enjoy doing? Who is he? He's just a name at the moment. How important do you think it is to go into people's life history and values? Is that overly invasive, or do you think it's necessary as a part of the befriending process?
I think it depends on the comfort of Mr. Sal, the client. Yeah, and it is a process. I don't mean that, the first session, there I go, and ask all this stuff. It's not going to work. Yeah, it is based on trust. And for him, when I look at him, he is somebody who, I don't know, his wife passed on 7 years ago. Is there grief issue? I don't know. Can he connect with somebody else besides the wife? I don't know. Is there a relationship? Yeah, and this son is far away. Are we able to put him back in the equation of care? I think it's important. Probably his yearning is to connect with the son. Yeah, so these are the things slowly, if I get to know this person, I will be curious to check in with him. And of course, in the process, it's a friendship building. Self-disclosure is important. But it has to be appropriate self-disclosure, you know. Yeah, but before we go into all this, you know, or maybe I should advise as a supervisor, what can I do to support the volunteer? I'll go you know, that later. Yeah, I don't know whether I answer your question.
That's fantastic, thank you. Let's just see if there's any questions. We have an audience.
Yes, hi, Kok Yang. We kind of have a situation like this, and we will use befriending as some sort of an intervention, and then there's a lot of things that you talk about that's to be done. But it seems to be a very kind of labor-intensive kind of way of doing things, right? Because there are, you know, actually in my clinic every week I see such a situation come in. There are many families and there are many elderly people that are in such a situation. So I just want to ask a question about whether or not the intervention should be in the form of facilitating communities rather than, you know, looking at, you know, getting specific people just to go around befriending everybody. What are the thoughts?
I think it depends on the needs of the client. Some clients are introvert, you need to start from individual. And then you slowly, you know, the goal probably, the care goals at the end of the day, yes, is to encourage them to AAC, is to encourage them to daycare. Yeah, but that, not like what I've heard enough that not everyone will want to go daycare. You know, is there a purpose for them to see that they need to go daycare? Yeah, so yes, of course, we can gather everybody together, but again, I think I will go back to the needs of the client. The assessment is important. Yeah. The other thing that suddenly came to my mind, I think of my dad. He passed on a couple of years ago. He is very introvert. All his life he has been working, and he doesn't like to socialize. He would rather sit at home and watch TV, read newspaper the whole day. Until one fine day I decided that maybe I would get a befriender for him. And then slowly I asked him, do you want to go to daycare? The reason for him to go daycare that he shared with me was, I will go so that you can go to work with a peace of mind. Now that is very important to me. That is the way he contributes his love and care for me, even at the stage that probably he needs care. But as a role of the father, it is very important for him to continue to care for me in different ways. So the language of love is changing. Are we able to explore that? So when we work with Mr. Sal, when we work with our client, what is the language of love that's changed? You know, for Mr. Sal, probably he lost the role of a husband. He lost the role of a father. And he yearns that. Then how are we going to connect him back? Yeah. So again, I don't expect the befriender to do so many work. Yeah, so for this case, again, when we do assess, there are actually, I feel, more hands needed to support this case. Yeah, which I think it is also one of the questions later. As to the support, as to the volunteer befrienders, right? I just want to add on something here. Is the training of the volunteers is very important. Because Mr. San Gupta, right, he is a retiree. He wants to make his life meaningful and purposeful. So I have two elderly to care for here. Not only the client, Mr. Sal, but encouraging, you know, Mr. San Gupta to achieve what he wants to achieve in life, to continue his journey, to make a purpose in life. I think that is very important. And how can we support and help him? Yeah. So for training a volunteer like that, they need to understand the older person. They need to understand their care needs and finding hope. Now, this is important in terms of finding a hope for our seniors, for our volunteers. Yeah. So what is it about this hope? If I cannot find a hope together with the client, I think I'm lost. Yeah. Sorry, I think I talked too much, is it?
We should. Thank you very much. Yeah, that was fantastic. We should keep going because we have 2 more contributions. Thank you. So if we could go to question 3, and I'm going to come to you, Kalyani, in a minute, but first of all, I'm going to go to Kenny, if that's okay. Question 3. How do you think befriending is related to the work of care managers, social workers, counsellors and medical professionals in the ecosystem of care in the community? How effective do you think such an ecosystem of care might be in reducing social isolation? Now, I think, Kenny, you wanted to give a short speech. You've got a slide, is that right?
I was just going to respond about my own personal struggle and dilemma about this term called befrienders, because we have formalized and institutionalized a role that what Noreen mentioned about, that it is a societal community issue, that as a nation we need to be friends to one another. It is not a role that we appoint, it's not a role that we pay for, but it is a mindset, a paradigm of a nation. So I don't know, right? I mean, this is really above all our pay grades, but really that's that formalized befriender. But we are all potential friends to one another. And let me just share about, I have this client in one of the centers who has adopted me as the grandson. So every time I go to this center, I look for her because she smiles at me and she hugs me. She's cognitively intact, by the way. And she's so jolly, right? So I love going to the center and just connecting with her. But we never had real conversations. It was just, hi, you look good, you're still looking better and better, that kind of thing. But one day, we were just sitting at a table. I was having lunch in the center, and she just happened to come and sit. And I asked her, I haven't seen you for a while. What happened to you? And she said, my husband died. And I didn't come, and she started crying. First time in my life, in my interaction with her, she's a jolly old lady, but she actually broke down and cried. And I said, I miss my husband. As a medical professional, I'm taught to de-link, right? My emotions, and it's just medicalized this, But what could I do? I held her hand, and I wanted to cry with her. I said, I'm so sorry, right? She's getting more and more frail. Right? And there will come a time where she will really no longer come to the center. My question is, was I a befriender? Not a formal befriender, but I think I was a friend. I don't think I was a real friend at all those times when I hugged her, but I think I was a true friend when I held her hand and got teary-eyed with her. So, just a response to you, but I don't have a speech to spill, but I was just thinking and responding to Angelique and her speech. And I went to Japan in October last year, and I met 3 individuals in Japan. I'd like to share very quickly, about 1 minute per picture. If you can put out the first picture. I met this man in Japan. This gentleman, we talk about men who love to do things. So we found out that this gentleman was living with dementia. And to our horror, he was holding on to electric tools. And he was drilling holes in the sidewalk. And in the Singaporean context, we will never allow someone with dementia to hold electric tools. But the Japanese hosts were telling us, look, he has been a carpenter all his life, muscle memory. He's not going to drill a hole in you, he just drills it in the wood. And I kind of wrote a poem in his voice, if I could just share with you. I used to plan each day in vain to keep my soul from strife and pain. With much to do and more in mind, I thought I saw, but I was blind. And now as precious memories wane, I live each day through shine and rain, with love to do as hands they find to savor work of every kind. I'll never live each day in vain, but filled with joy instead of pain. Let carpe diem spring to mind, for now I see, no longer blind. Is that connection? I suppose that's connection. Is that giving opportunity for an older person to remember what he used to do? Is that meaning? Was he lonely? He was alone, but I don't think he was lonely because he connected with what he used to do. The first person. The second one, we went to another daycare center. This time we saw ladies, right? They were supposed to do trips out, but it was raining. And so the daycare center decided we'll prepare lunch. And these were all these sprightly old ladies living with dementia. And they were just preparing lunch. And horror of horrors, again, this lady was holding a metal knife. I mean, the Japanese are fantastic, right? Metal knife, we would never allow that, right? But she was holding a metal knife and she was just chopping away. And I was wondering who she was preparing a meal for. I was thinking perhaps that's her voice, right? Maybe she thinks that she's preparing for her son who is still in school, but the son is already grown up, right? Remember me when I'm done, this meal I make for schooling son, each portion wrapped with mother's love to fill his heart with every serve. She won't recall when she is done, this meal she made for working son, yet what is lost is found in love to fill one's heart with every serve. So what remains when all is done? Forgetful mother and her son? It doesn't matter when in love our actions for each other serve. So, was she lonely? I'm not quite sure. But if she wasn't allowed to do what she felt she was doing meaningfully, I think that's true loneliness, right? So I think we got to kind of reframe and remind ourselves what is loneliness. The last one before I pass the mic back. Final space, we went to this very isolated village. There was this lady, 90 years old. This daycare center is intergenerational. They've got students from other villages who came and kids and this old lady, and she was just sitting there. She never understood a word we said, right, because she's Japanese. And she was just sitting there looking at us. And through a translator, we asked, is this daycare center making any difference to you? She said, yes. And we asked why. She said, if there was no daycare center like this, I wouldn't know where to go. I'll be lonely. And every day she just goes to the center and sits there, like Mr. Sal. Okay? So she sat through 2 hours looking at us, looking at her. Okay, so final. She sits to watch her world today, so cold yet warm in autumn grey. This house she calls a home by day, where young and old share time and stay. I wonder what she saw today, if colors added to her grey. By presence hours at start of day, if memories of us would stay. I'll treasure what I saw today, this sprightly grand with hair so grey. She surely added to my day within my heart where moments stay. I think at the end of the day, it is entering into the space, into the context, into the reality of every elder, dementia or otherwise. And when that happens, there's no more loneliness. I'd like to just put that on the table for us. Thanks.
Thank you very much, Kenny, and thank you for those wonderful poems and this sort of profound near end to the day. Kalyani, I think we should turn to you and have your contribution on question 3.
Thank you, Chairman. Are you able to hear well?
Yes, very well, thank you. And we can see you.
So I was asked to look at the whole case from a life course perspective and from the perspective of a gerontologist. For those of you who are not familiar with what gerontology is about, it's the study of aging and aged populations, as well as the social and emotional process of aging. And this case is quite interesting because Mr. Tsao has been a widower for 7 years. I did a research on widows and widowers, and we found that there is a definite gender perspective to their experience. Widows tend to adapt better through their transition into what we say singlehood again. From the gerontology point of view, I think men find it harder to live their life, especially if they had a very fulfilling marriage, because their entire connection to the world could have been through the spouse, and the wife could have been the connection to the world. So imagine Mr. Tsao, who seems to be an introvert. However, I agree with the panelists earlier that aging limitations like vision and hearing could be part of the reason for him becoming an introvert. However, he may have a personality that is quite happy to be at home. My husband is like that. And it's just a personality thing. They're just happy being within the four walls of their home. So we cannot judge Mr. Tsao that he is socially isolated or he's lonely. He may be alone, but he may not be lonely. So the first thing I realized through this case is that Mr. Tsao may have had hopes that his son may give him more support. However, this support is not visible, at least in the case study that we see. So he may be disappointed in the support system he's getting from his family. He may still be grieving, like one of the panelists said earlier. So from the life course perspective, we need to know what was his relationship with his son? What was his relationship with his wife before she passed on? What is his relationship with neighbors? And in Singapore, we tend to shy away from being too friendly with our neighbors for whatever reason. So I've seen other communities where neighbors know each other very well. But in Singapore, this tends to occur less frequently. So it's possible that over the 7 years, he is still missing his wife, and he's never really adjusted to this transition to widowhood. Let's move on to the next question, which is how do we build resilience so that as people age, they do not get into this situation of quote unquote unwanted loneliness. This is a term that I came across when I was asked to look at this study. So unwanted loneliness and wanted loneliness, is there such a thing as wanted loneliness? I don't think so. We are all social beings, so we really want meaningful relationships with other people. So deep down, I think he would probably like to have friends, but he has lost all his connections, and he's probably lost touch with his extended family as well. So if we want to start with Mr. San Gupta, trying to become friends with Mr. Tsao, we really need to know the history of Mr. Tsao. Like what I think Noreen said earlier, we need to know how he came to this situation that he's in today. So a lot of looking back, somebody mentioned reminiscence, thinking about how life used to be, how life is now. And actually, to build a relationship takes a lot of time. I think it would easily take about 6 months for any befriender or any extended family member to reconnect with Mr. Tsao. So we really need to be patient and give time to people who have been alone for a long period of time. We need to really, really sit and be the listening ear, not wanting to push things too fast, but really let them take their time to share about their lives. And sometimes silence is also a way of connecting. So I have seen many a time where two people sit silently, but they're actually connecting through their other senses. So in a sense, when I think about resilience, I think social capital is one of the things that comes to mind. when we are in our 40s and 50s, we are so busy with work, but it's important to maintain our social capital, whether it is with childhood friends or whether it is with community connections. The other thing that I did think of is technology. Perhaps we can also tap technology for Mr. Tsao. If through the activities we find that he's interested in using mobile phone or iPad, that's another way by which he could connect with his son or with maybe other relationships overseas. So technology can be devised to help Mr. Tsao to expand his network at this point. Ecosystems of care have been developing in Singapore in many forms as well as many structures. And we are really progressing in this field. However, I think there is still not enough integration of social and healthcare. We are trying our best. I know a lot of the audience here are doctors and nurses. So I am quite well aware that there is much effort being put into this integrative process, but still, I think we have a long way to go. In understanding Mr. Tsao, we need to know his medical history, but we also need to know his social history to help him to enjoy his life more and not to be alone and not to feel that society doesn't care for him. Of late in Singapore, we've had many cases reported in the Straits Times and other papers where the elderly is found dead in the flat after 2 or 3 days when neighbors get the smell or stench. And this has perhaps awakened the conscience, a lot of us. Are we really, as a society, doing enough? Are we really keeping our eyes and ears open for our neighbors? And I totally agree with the rest of the panelists who say it is a societal landscape, a societal effort. We cannot put this only in the hands of professionals or leave it to the befrienders because the befriender may also need support, as Yoling said earlier. So lastly, I want to say we must not jump to conclusions. We really cannot jump to the conclusion that Mr. Tsao is miserable or he's lonely. We need to have more depth in our understanding of him so that he will be willing to open up and share his life story.
Thank you very much, Kalyani. That's fantastic. We've run out of time almost for this session, but are there any questions from the audience for either or any of the panelists? We are going to have a really exciting audience-led poll in a minute, but before that starts, where you get to vote, are there any questions for Kalyani or Kenny? Okay.
If I may, just a quick one for Dr. Tan. Dr. Tan, I know you run St. Luke's, and St. Luke's is a mission-based organization. Well, actually, I don't know whether it is, but I assume it is. And it raises a question which one of our audience asked yesterday about the role of spirituality in care. And I think Noreen showed a chart just now which showed that that's actually common between men and women, religious faith and practice. So the question is this, in a place like St. Luke's, are you allowed to help clients with that? And the reason I ask this is simple. Let me give you a background why. I actually work in a daycare center 2 days a week. And when I tried to help a client with that, I was told, stay away from that. That's religion. And they showed me the contract I signed, which says that, you stay away from religion. I said, but she's Indian and she doesn't do Chinese calligraphy. Why can't we just make her copy Bible verses? And they're like, no, that's off limits. Stay off that thing. And then so I complied. But I did whisper to her, I said, if you write your Bible verses, I can't stop you. And so she did.
Thank you for raising this up. This is so exciting. Before I answer, any Ministry of Health people here, so I can... I was just going to respond, we are social beings, right? So we need to engage. We are learning beings, we need to explore. We are spiritual beings, we need to expect. One of the things we kind of struggle with, whether you are faith-based or not faith-based, there's a difference between religiosity and spirituality. Spirituality is about expecting something beyond the present, trying to connect with something or somebody beyond yourself, finding meaning beyond my present. And we asked that question as a faith-based organization. And we came to the conclusion, number one, we are living in Singapore. We are multicultural, multi-ethnic, multi-religious. I think we should not and must not shy away from conversations on spirituality and religion. Because as you get closer to the end, you want to connect with whoever you were trying to connect to in your last 50, 60 years, right? You have that spiritual question. You ask that. Last year, we ran a seminar. 60% of our elders live with dementia. And we asked that question as a faith-based organization, not particularly Christian, right? It's faith-based. What happens when you lose memory of God? For people who practice religion, right? Whether you're from the Muslim community, Christian community, a Buddhist, when you lose memory of a ritual, of something that connects very emotively, right? What happens? A Christian who no longer remembers the Christian God or does not participate in the recognized Christian rituals, or a Muslim who no longer prays 5 times or doesn't remember, is that person still a Christian or a Muslim? What are the questions that caregivers encounter? Is my mom still, So we asked that question at that seminar and conference. We had some colleagues from the Malay Muslim community who came, knowing that it was a Christian faith-based conversation. I had a conversation with this colleague, and of course I was trying to ask, you're in the right place, huh? Because I wanted to be sensitive, right? And she said, yes, I came specifically for this conference because it is a question that we all need to ask. And she said, I wish my community were going to ask that, right? And I think it's great that you brought this up. We don't follow a contract. We do pastoral care. Pastoral care for people who are journeying in their different faith journeys. And we respectfully help them to find closure, help them to find that meaning towards the end. And we respect the religion, but we are approaching it from the spirituality angle. I mean, if I could answer that, yeah.
Thanks very much. I'm sorry, Sumi's giving me this very tight schedule, minute by minute, literally. So I think we have to move on to the poll. So could we get the poll questions up? So what's going to happen here is you're going to vote, and then I'm going to ask the panellists to reflect on the answers, and then also to involve you in the answers. So question 1. So this is going to be a very rough and ready poll. We have our assistants here who will count the cards. So we want you to, the first question is, how were the everyday capabilities of members of your household affected during the course of the lockdown periods? Put up the red one if it was improved, red, yellow if there was no change, and B and declined, put up the green one. Okay.
Sorry, I have to ask, what does everyday capabilities mean?
I don't know, Sumi. I didn't write these questions, so I think just take your best guess.
Okay. Does it include baking, crafts? yes, because
I don't know, I guess whatever you're capable of doing every day. All right, have we got you got enough data? All right, there's only 6 questions, so don't sweat. Okay, the second question is, how was the mental health of members of your household affected during the course of the lockdown period? So, same thing, improved, red. B, declined, green. It should be the other way around, but anyway. And yellow, no change. So don't get confused. Red means improved. All right. You're really participating well. What a good group. End of the day, still got your hands up. Participating, what a community. Okay, you got enough answers? All right, number 3. Did the members of your household feel that lockdown restrictions were well calibrated? Now, don't ask me what well calibrated means, all right? It's a Sumi's question. Were well calibrated to prevent harms to their everyday capabilities? Okay, again, in this case, yes is red, no is green, and yellow is unsure. All right, lots of calibration there, good. All right. Matvi, have you got enough? All right, we're nearly there, past the halfway mark. Just wait till you see the results. Number 4, did the members of your household feel that lockdown restrictions were well calibrated to prevent harms to their mental health? Red, yes. Green, no. Yellow, unsure. Matvi, are you done? Well done. Okay, number 5, second last question. Did the members of your household feel able to take care of their mental health during the course of lockdown periods? A, yes, which is red. B, green, no. And C, unsure, yellow. Oh, lots of red. Sea of red. All right, last question. Did media coverage of information about the pandemic, in brackets, infection rates, hospitalisations, deaths, which groups were most vulnerable, etc., have any adverse effect on the mental health of members of your household? A, yes, red. B, no, green. C, yellow, unsure. I think any was pretty sort of, of course, it had some somewhere. Anyway, that's your question. Okay, so Matvi, can we get them up on the screen? Okay, I'm supposed to summarise something here about the different groups, particularly, but I must confess I haven't managed to pick out any groups. So I think I'll just wait for the results. Sumi, do you want to say anything as a filler in this?
This was really in response to the question that was asked about religious or spiritual care and whether it's allowed. I want to emphasize that the Singapore Medical Council 2016 ethical guidelines say that you are allowed to offer spiritual care, but that you should refer to an authority if you feel you are unable to do it. Then, of course, there's a definite no against proselytizing, and I think we all know that. But the ethical guidelines say that you can offer spiritual care. Then I'm just going to, as an aside, while they're doing the results, is that just a couple of days at the end of last week, I was having a short conversation with one of the St. Luke's Hospital chaplains, and I was just curious. I wanted to know how they worked and how they offer spiritual care, and they're the utmost professionals. It is really about spiritual care. It's not religious care unless the person or the patient or the family requests for it, because they're trained in counseling, and pastoral care is really counseling. It's the counseling framework, but you are looking at it through the lens of a person's spiritual identity. And so therefore, everything is led by the patient, the client, or the family, how they choose to see it, whether they is faith-based or not, whether they are very religious or not. So it totally takes their perspective. And I think as long as we do that, then there is no danger about straying into the unwanted, the unknown, or the unwelcome.
Okay, I just wanted to make one comment. Noreen raised a very important point about, and I'm sorry if I'm paraphrasing, but the ability to sit with oneself. And this goes back to the idea of prevention. And apart from maintaining social convoys, I think as individuals, we need to get better at being able to sit with ourselves. Because the ability to accept oneself and have and meaning, and the idea that you have meaning and purpose in life, is an antidote to loneliness. And I think a lot of us rush around and don't spend enough time doing that. So I think if we want to prevent loneliness in future generations, we should encourage that capacity within individuals. That's my last point.
All right, thank you. I completely agree with that. So we have the answers, have we? Are they here? Okay. So panel, I'm going to come back to you, including you, Kalyani. We're just going to get some audience response on each of these questions. So for the first question, how were the everyday capabilities of members of your household affected during the course of the lockdown periods? The most popular was no change, middle option declined, least popular improved. Does anyone want to say anything about that particular response? Do the panel have anything insightful to say about that response? You don't have to say anything. Okay. All right. Yeah. Kenny, okay.
I just wonder whether it's got to do with the context that you're in. In our context, when we had the lockdown, we had to send 2,000 elders home for 1.5 months. And that affected the everyday capabilities of those households, the mental health of members of those households. So I suppose it's contextual, right? I mean, if you don't have an elder who was affected, possibly you won't be affected. I mean, I'm just responding to that. I don't know. Yeah.
Thank you. That's great. Okay, well, let's go to the second question. How was the mental health of members of your household affected during the lockdown? Most popular choice was declined, middle option no change, least popular option improved. Any comments about mental health implications of lockdown? Yeah. Again, do any of the panel have any particular insights there? No? Okay, well, we'll go to the third one. Did members of your household feel that lockdown restrictions were well calibrated to prevent harms to their everyday capabilities? Yes was the most popular. No was the middle option. C, unsure. Again, any comments on that? No. Did members of your household feel that lockdown restrictions were well calibrated to prevent harms to their mental health? In this case, no was the most popular option. So what do you think was wrong with what was the problem that you thought was...
I actually think it was the uncertainty. I speak for myself, but I'm pretty sure that throughout this whole last 2-3 years, it's never knowing what was happening next, and things were getting better, then it would suddenly get worse. And then when we had that surge and numbers were going up to the 5 figures, I mean, I live with my mother who is in her late 80s, and she was anxious by the figures. She was wondering how long this would go on for. I suspect, but at the same time, I think because it's been 3 years and we went through so many phases, in a sense, I wonder if all of us have had a chance to really sit down and unpack it. Because they kept on telling us new normal, new normal, new normal. It's like everyone's got new normal. Yeah, the new abnormal is like, don't know what. But I think, is it Prof Liu Yisin who had that great phrase about the hammer and the dance? Like circuit breaker was the hammer. You would just whack and you just press the reset button. And then after that, the last 2.5 years was the dance. We had to learn how to dance with this virus. And some of us are better dancers than others. And many of us were still trying to keep in step. So I do suspect that if there's some uncertainty, it could be that we really haven't had the chance to sit down and work it out for ourselves. What's happened? How do we feel about it? We're just living by the moment and just trying to survive. The world is opening up. People got revenge travel and all that. But I think for many of us, I suspect there's a little bit of low-level trauma that is still ongoing. If not for ourselves and for our families, and certainly for our patients. Having to see my patients die alone, their families not being able to contact them, is something that will all of us, each of us healthcare workers, going to have to work on in the years to come.
Thank you. Okay, number 5, did the members of your household feel able to take care of their mental health during the course of lockdown periods? Yes. Well, what are your reasons? Why, how were they able to take care of their mental health? What was the reason for that response? Anyone? Panel members? In my case, I loved the lockdown because I could do lots of exercise. We were allowed to ride around in England. So that was a good period of mental health. But anyone, other contributions? Okay, last, did the media coverage adversely affect your mental health? And the most popular choice was yes and no. I thought it was yes, but what were the reasons for that? Any reasons? I think everyone's getting a bit exhausted. All right, I'm going to ask the panel, are you happy with our analysis of the data, assuming? Okay, so I'm going to ask the panel now and then move to the audience. So I want to ask the panel to comment on policies that worked well or not well to maintain everyday capabilities of vulnerable groups during lockdown. And I thought we'd start with you, Yong. And then I'll pass to the other panel.
Okay, I think what really is not working well is either the overprotection from the children based on all this media and data. So even though after that it is a bit ease, but some family members will not allow us to make home visits. Yeah, you have been moving around as if we are the virus that will bring to them. So we got to change masks every time and explain to them. So that was very tough. Yeah. And some children or older person actually reject vaccination. So these are also some of the challenges that we have to go through. Sometimes they need help, but they are not vaccinated. So are we at risk as well? So there is a lot of struggle on the ground. Yeah. That instill a lot of fear and anxiety. Working from home, of course, has its pros and cons. If it is, I was looking at the data, I was thinking, maybe most of us have good relationship, therefore it works for us. But you come from if your client has poor family relationship or caregiving for 2 older person, or in 1-room rental flat or 2-room or 3-room, it is very challenging. They have no room and nowhere to go. Yeah, so the caregiver stress is actually very high, and the roles are also mixed. Yeah. So these are some of the challenges, especially when you need to care for a person living with dementia that has BPSD, for example. Then how do we support care? Yeah. So some of these I find it is really challenging for us on the ground to look at. Yeah.
Kalyani, you've been left out a lot. What do you think worked well and what didn't work in terms of maintaining everyday capabilities of vulnerable groups?
Right, thanks. What I heard from many of the service providers is that during the circuit breaker and subsequently also off and on, the daycare centers had to completely close. So those regulars who used to come down to the social care centers or day activity centers, this social activity, sometimes inclusive of physical exercise, was completely zero for a long period of time. And I think if we ever were to face this kind of a pandemic situation again, perhaps we could do things differently, because this sudden truncation of connection to the world can be very, very traumatizing for people, especially those who are alone at home most of the time. And therefore, they value that space and their friends. So it's possible that in future, if ever such a thing were to happen again, I think the daycare centers would need to remain open for maybe even 1 day a week. So that was one of the points I wanted to make. The other was that caregivers who were the middle generation caring for elderly as well as young children, they expressed that they were literally burnt out, and often they just snapped. So this mental health really was deteriorating for them. What more could be done? I'm not too sure, but perhaps respite options for caregivers could be included in future, even if it is only for an hour in a day or something like that. We have still an underlying kind of uncertainty, what is happening in the world, and really one thing after another, that COVID pandemic has just about becoming more of an endemic, but then war, earthquakes. Today there was a major earthquake in Turkey. So it seems like climate change, shocking waves, as well as medical and perhaps even political situation, has really made a lot of us feel very insecure. We don't know what's coming next. You know, it's that kind of feeling. A lot of elderly express this, that at least in the past we knew what was happening. Right now, you just don't know what's happening. We don't know what's going to happen tomorrow. So that's my small contribution to this.
Thank you, Kalyani. Thank you. Does the audience have any reflections on the strategies that worked or didn't work to maintain the capabilities of vulnerable groups during lockdown? Is there anything you would like to share with us? Jacqueline, are you?
Yes, hi, Julian. Just wanted to add that I think over the course of the pandemic, we learned. So I know of a study that I read that came out of Tan Tock Seng Hospital. They began to do an audit of medical records of patients who had gone for, for their dementia care clinic visits. During the pandemic, over 6 months, they had that data, and then they compared it with the 6 months before the pandemic started, and they found alarmingly that there were a lot of health and mental health issues that were rising during that pandemic period. And so I believe in that article that came out of the Tan Tock Seng team, they alerted the government that they urgently needed to open up some places in daycare centers, senior care, various dementia care centers, for instance, to allow some families respite. I just wanted to add that. So over the course of a pandemic, it may be that initially people can cope, and then later they can't cope. And then, maybe there is some intervention and people can, start to adjust. But it doesn't stay static, I think. Thanks.
I think we're going to move on to the last question. We're going to involve the remainder of the panellists and the audience. So the last question I'm being scripted by Sumi to ask is, could you comment on the policies that worked well or not so well to maintain mental health or resilience of vulnerable groups during lockdown? And Kenny, you've been targeted to give the first answer to this question.
I'd like to reframe the definition of vulnerable groups. We always think that vulnerable groups are your clients and the elders. I think in our context, we also had a vulnerable group called staff, because we have a mature workforce in St. Luke's. 50% of our staff are 50 years and above. 20% are 60 years and above. Are they vulnerable? Yes. So you have the vulnerable taking care of the vulnerable. And when lockdown happened, circuit breaker happened, everybody was affected. Our staff who were taking care of other people's parents feel guilt that they were not taking care of their own parents. Right? That's one. Number two, when we had to close certain centers because of cases, and our staff were also isolated, right? So they had free hotel stay and everything. They were staying alone in the room, and a lot of our staff who are mature workers have never been in a hotel room alone before. It was very interesting. And what did we have to do? We had to Zoom. And what did we do during Zoom every day for 15 minutes? We did pastoral care. Suddenly, religion doesn't matter. Whoever can pray, pray. Really. It just united all of us, right? So that was very interesting. One of our staff said, it's very scary. I don't know whether I'm hearing things at night, you know, but nobody's going to come and talk to me, and we had to do it via Zoom. We had to provide pastoral care via Zoom for 15 minutes, and that was scary, right? So these were some of the things. So I'd like to reframe our definition of vulnerable groups. Actually, our staff are very vulnerable. They suffer from lots of guilt. Even recently, when we visited our centers, we have certain staff just saying, you know, I come on a daily basis, I spend 8 hours with other people's parents. When I'm going home, I don't have enough energy, time to spend with my own parents. COVID or not, there's that guilt. But I think COVID adds on to that, because as they're caring for the vulnerable in their care, they're worrying about the true vulnerable in their own household. So I think did it work well? I'm not quite sure I'm answering the question, but I mean, COVID just really screwed our lives. I mean, right, sorry. Oops. Yeah, but yeah.
Thank you. Well, Maureen.
Okay, I don't want to spend all my time talking about what the government didn't do well, but I think I just want to acknowledge that one thing I think was very important that the government did well was to reopen the schools as quickly as possible. When we think about other countries where the kids didn't go to school for 1.5 to 2 years, as in person, as soon as it was safe, actually they reopened. And that was I feel it was a great relief, because parents could finally see the little ones off and have a little bit of time at home. And it was so important for the kids and the young people to be able to interact with each other. And I mean, I have a nephew who is now in secondary school, so he spent a long time of it through COVID. And I could see how it affected him when he had to do online learning, and how happy he was to be able to go back, and how delighted he was that when contact sports were now allowed. And I suppose children are also a vulnerable group, and I feel that this was something that was very important, and I think it was done well. That's the one thing. So I shouldn't not all just big bets for the government, but that's an important bouquet as well.
Well, I also don't want to comment too much on whether the government did a good or bad job, but I have to say that I'm glad I was in Singapore. The question is, and because I'm a survey person, I read the words in each question very carefully, and did public policies harm or improve well-being, esteem, and resilience? I don't think there were any policies focused on well-being and esteem. So I think that we did do well in terms of preventing the spread of disease, but the policies were very focused on that. And I think now we're dealing with the aftermath, as Kalyani was saying, and that policies need to really focus on mental health. And we need more call lines. we need more spaces to talk about what's happened and unpack it, as Noreen says as well. So we're in a new phase.
Okay, brilliant. Well, sure.
Yeah, actually, I don't know whether is it relevant, but I certainly think that I need to appreciate the service partners in the community, because during the lockdown, some of the services are unable to make home visits, and we depend a lot on essential service partners. And I'm really very thankful to them, whoever is out here, you know, that we can really collaborate together as a kampong to really serve our seniors out there. And it was amazing. I think that was the period that we have the most case conferencing over Zoom. Every single day, every time we report. I thought that was very positive energy, and that keeps us going very united. Yeah, so on the other hand, I really appreciate AIC, you know, who is able to give us the direction, and we just follow law, you know. Yeah, so I really want to take this opportunity to really thank the partners out there. Thank you.
Thanks very much.
And before I forget, we need to call out one more vulnerable group, and that's our migrant workers. If there was one thing that COVID taught us, it was to highlight the great inequity that we have in our society, and how the migrant workers, these are people who build our homes, who keep our streets working, or look after our elderly, look after our young, how vulnerable they were, how terrible their conditions were. So if there was anything that I feel is important, is that at least now we recognize them as important people in our society. We cannot function without them, and we have a responsibility towards them. So, and I was happy to see that at least there are concrete steps being taken. There's still a long way to go. There's still a lot of inequalities and inequities within our society, but at least I hope that we are making the right steps in the right direction.
Okay, thank you, Noreen. Justice is an important ethical issue. I'm meant to summarise the whole of this session, but I'm just going to draw a couple of ethical points. And picking up what Angelique said, Singapore, as an outsider, did stunningly well at reducing COVID-related deaths. Did the best in the world, in fact, better than Norway in terms of deaths per 100,000. So on the metric of prevention of COVID deaths, Singapore did extremely well. But COVID deaths are not the only things that matter. All deaths matter equally, COVID and non-COVID related. And then death is not the only thing that matters. Mental health, well-being. There are a whole range of values that we have to balance and measure. So one of the problems in the pandemic was there was this obsession with COVID-related deaths without balancing all of the other important values that matter to everyone. So that's an ethical issue. What are we measuring? Are we measuring COVID deaths? Are we measuring deaths? Are we measuring lost quality adjusted life years? Are we measuring well-being in some way? That's a fundamentally ethical question that we have to decide, and it's a measurement of how well we're doing as a society in a pandemic, or in the care of the vulnerable, or in the care of the aged. So that's the first point I want to stress, to pick up on that point, that fundamentally these are ethical issues about what matters. The second point is there are two basic ways to decide what matters. So if you want to ask, what is a good death? Or in the case of Mr Sal, what is a good relationship? There are two basic ways or perspectives on answering that question. The first one is, it's determined by the person's own values. A good death is the death that the person values. A good relationship, or a relationship, is the relationship a person values. Not necessarily what they want at the time, but what they value in terms of their life history, their autonomy, and their identity and authenticity. So a person's values are a way of answering the value question about what's good or bad for them. The other one is a more objective view. A good death is a death at home, with family around, without intravenous lines. Or a good relationship is a relationship where there is, mutual exchange, engagement in mutual activities, whatever your criteria are. So often we face in ethics this distinction between the subjective and the objective. The subjective is the person's own values. The objective is some external impartial view of what's good for that person. So it's often important when you're getting to a question like, what is loneliness? Or what sort of relationship should this person have? Or what sort of death should this person have? To ask, are we asking the objective question or are we asking the subjective question? And it seemed to me in this debate that was a very important issue, because I think, as some of you said, it may be that some people learn to live with themselves, are happy with themselves, and don't desire the sorts of relationships that other people desire. And that depends on whether you take a subjective or an objective approach. And then Noreen's last point is, how do we distribute value throughout society is a question of justice. And that's a fundamental ethical question. We can all talk about equality. Equality is never achievable, and the question is how much inequality is justified, or what kinds of inequality are justified. And so at the heart of all of these questions, at the heart of all of these issues is ethics. And that's why ethics is the most important discipline when answering any of these social questions. So that's my summary of the, which is kind of idiosyncratic summary, not really a summary at all. But now I'm going to pass over to our boss, Sumi. Please join me in congratulating Sumi. You don't know how much work goes on. Meticulously organised. Thank you, Sumi.